Good day once again. Dr. Yakub is my name, Dr. Wildlife Hospital, Abuja. We're here again to talk about something that we know it's becoming an issue in our society. In this case, specifically, we're talking about male infertility. Long before now, almost everywhere in the world, once a couple does not have a child, in most cases, it is a woman that they blame. And the man, as long as a man can meet his wife or partner, he is not considered to be the cause of a problem related to infertility. Fortunately, we're beginning to see now that men are almost equally as guilty or as responsible as women when it comes to infertility, that is, childlessness in a family. And why is this so? Well, male factor infertility seems to be growing. That is, for whatever reasons we don't know, and but it appears as if nowadays we see men who cannot father children as commonly as we see women who also have issues related to infertility. In fact, statistically, men are responsible for infertility 35% of the time, as well as women at 35% of the time. That makes it about 70% men and women. The rest is considered as unexplained or both of them. So, what is the reason why do men have infertility, or why would a man not able to bear a child or have a child of his own? There's so many factors, but all of them and everything related to male factor infertility is everything and anything that can affect the quality of the sperm of a man. So everything that can affect the quality of the male sperm affects his fertility profile. Now this ranges from lifestyle, or let me start with some genetic issues. A man may be born with some conditions that, well, they are genetic. That means inherited from his parents, that can predispose him to infertility in life. Some of these things is not his fault, and he was born like that. There is a condition called cystic fibrosis, and I won't be going so much into that, but genetic conditions that a man is born with may predispose him to infertility. Sometimes, while growing up, there are some kind of childhood infection, particularly in this case, mumps. There's this virus called mumps. Mumps parotitis. It's a common thing, especially in villages. You see children coming down with swelling around the jaw area, and some of these viruses, if the infection at the time is severe enough to affect a young boy, to the extent that his testicles are affected, then that can cause what we call mumps-otitis, and that may destroy his testicles forever, and that is the end of fertility for him. So especially where both testicles are affected. Sometimes it's accidents in childhood that could have affected the testicles. Maybe a child is, by the way, maybe riding a bicycle and he has an accident, and those accidents perhaps destroy his testicles. Of course, that will eventually cause him infertility later in life. Sometimes surgeries, certain types of medical interventions, we have seen people who have had some surgeries, particularly in the hands of people who don't know there's quacks in this case, who have done herniorrhaphies or hernia repairs for men and completely transected, or this thing that conducts sperm from the testicles to the outside. We call it vas deferens. They just transect it, they just completely either occlude it or tie it up or remove it, and then the man is never able to have children unless he's assisted in some way. And so some of these things happen. Then lifestyle. Men who smoke, especially heavy smokers, alcohol, these are substances, social substances that have been shown to reduce sperm quality as time goes by. And it is important that we know, particularly, of course, it's not every man. The argument people will make is there are men who smoke, there are men who drink and still father children. The truth about it is that we're all different in our mix. And so if your own smoking does not cause infertility, your own smoking may cause some other things in you. And so for those who have infertility and they smoke, it's just not enough to say that, oh, I know someone who smokes and still who is giving birth. It may be that in your case, smoking is directly affecting your own fertility, or the other person smoking may be affecting him in some other ways, or drinking of alcohol and the rest of them. So please, for those who have sperm issues and they smoke, please, it will benefit you from stopping smoking, or you will benefit from probably also stopping alcohol intake. Other things that we see these days is related to lifestyle. Sometimes any situation that exposes the human testicles to heat for long period of time, long hours in a day, for instance, sedentary lifestyle, or prolonged long distance driving, or the wearing of tight underpants where there is no free and cool aeration of the testicles, those things can predispose men to abnormal sperm parameters and therefore may cause subfertility or infertility in them. So it's important to know now in these times we're also beginning to see that certain occupations where men are exposed to some substances. For instance, we have seen men who are repeatedly or for a long time exposed to lead. Particularly, I have seen a few people who perhaps because of prolonged exposure to petrol or lead in petrol, they gradually develop abnormal sperm parameters over time. And so women who painters because of lead exposure and all of this. So sometimes occupational exposures to certain substances may predispose men to abnormal sperm parameters and therefore subfertility or infertility, as it were. Now, how do we diagnose male factor infertility? It's very simple. Usually what we do is sperm analysis. Once you do a sperm analysis, your doctor or your caregiver will know whether the sperm, as it were, you'll be able to have a child or not. If sometimes the sperm parameters, there are situations where men or some men don't have sperm at all. In the situation we call azoospermia. There are situations where you see that the sperm cells are there, but there are very few to naturally impregnate a woman. Or sometimes you see that such sperm parameters or such sperm may need some kind of assistance, maybe IVF and the rest of them. But by and large, it's important that following the diagnosis of after the investigations and then you're diagnosed with any abnormal sperm parameters, please make sure that you approach the right persons to manage your situation, as it were, because we've seen people who have had children before and later are not able to have anything at all. And so please, at any point in time that you and your spouse are not able to have children, don't assume as a man that it is only the woman that should go to the hospital for evaluation. Please avail yourself and make sure that both of you are properly investigated. And if you have found the reason, or if the reason for the subfertility or infertility is you, the man, please make sure that you seek help early enough. Otherwise, sometimes we see situations where delay causes a lot of damage and ultimately lead to a condition where the man has no sperm at all, and in that case, you may not be able to be helped. So by and large, take care of your lifestyle as a man, and make sure that you live healthy, you do a lot of exercises and all of that. And when you are diagnosed, seek help on time. Thank you very much.